Okay.
All right, our next presenter is Cindy Smith. She's the CEO at Bullhook Community Health Center in Havre. She's had more than 14 years of management experience working with nonprofit healthcare systems, which includes 3 years as executive director at the Community Health Center, 7 years as executive director of the Hill County Health Department, and 4 years as charge nurse in the transitional care unit at Northern Montana Hospital. She's a registered nurse in Montana and has attended the UCLA Johnson & Johnson Healthcare Executive Program. So Cindy, if you're ready, I'll turn it over to you.
Okay, thank you. I've been at the health center for 10 years, but anyways, it's we are doing an apprenticeship with 4 of our current biller and coders that we have employed right now to get their certified coding and billing certificates. We are giving them some time during their actual work hours to do some of the coursework that they have to take. We walked through, when we first started in the program, you know, we had to write letters of recommendation, make sure they were good candidates and that they were kind of self-starters, so that, and then to identify a couple mentors to work with them. So we actually have a certified coder here already. She's not doing that role right now, but she keeps current in her license, and then her certificate. And then she's also a nurse. And we have another RN that stepped up to be a mentor, because as they go through some of this training, they're learning a lot of medical terminology and different competencies that the nursing staff can also help as they mentor through some of this. They just started and kind of got underway in December and January, so a little bit of a slow start to get going on it. They're still working through some of their beginning lessons. So they take a lesson and then they take a quiz on it. And I think it's geared to take a couple years to get through with the program. Some might go at a faster pace. And then of course coding is a little bit different for community health centers versus some of the hospitals or the other clinic pieces, just because of the way our billing goes. So we have to always work that piece in. And 2 of the staff that are going to get their certified coding certificates are have worked here quite a while and understand some of that FQHC billing aspect and coding. So they have different projects too that they work with our providers to do some training for what they learn as well. So as they're doing that, they go and get data and look at current data and trends on codes and things that we're using across the health center. So some of those projects come out of the work they're doing in this apprenticeship. We found some of the things that we found is, you know, it takes a lot of time and we need to get them out of their offices sometimes to do the, to carve out time for them to do the work, or else sometimes they, you know, just get caught up in their daily work and don't think that they have the time. So we've learned that lesson, that sometimes we just have to get them out of their daily setting and put them somewhere else to do some of the quizzes and the lessons. Also making sure that the mentors check in with them often. That was a lesson learned too, just because sometimes they have lots of questions along the way, and then they wait to ask those questions until too late down the road. And so just carving out that time is really important, making sure that they know that that's a really big thing for them to have the time to work on it appropriately. We've made an agreement, you know, that they'll get, you know, a raise based on when they get this all completed. We give the mentors a little bit extra to help doing this process, so that they dedicate some time and know that it's an important project. We look at the competencies and talk about them too at different times with them, so that their support also from the executive team, and so their supervisors, the CFO, and so we meet often to talk about it a little bit too. So we're just kind of beginning the process, but we just see the need for all across the health center that this would be useful. The MA one that the other ones talked about, and some of the nursing ones, because sometimes clinical nursing is a little bit different than hospital nursing, or a lot different at times. So this whole work that we're doing together with Healthcare Montana has been so important. We've learned a lot, and gives us some good ideas going down the road for what we want to do. We're also we also use the LEAD program with our staff. That is kind of like a self-awareness and workplace, how to work with each other a little bit better. Everybody gets busy and they, think in their own zone. So we had one person that would go around each day and read like from the cards, and then there'd be a little mini discussion, 5 minutes, to talk about, a word or a thought of the day. And it kind of helped everybody realize, a lot of times how to step back and just think about their interactions with their fellow employees and even with the patients. And we continue to do that today, to just keep going through those cards and different lessons. So it was a good thing. It was all made up. They have it all ready for you to use, and it just helps to spur some reminders. So that was all very good too. I don't know if anybody wants to know the competencies that you do for the medical coder biller roles, but we have all of that information too as well.
So thanks, Cindy. And when Cindy talks about LEAD, what that is I don't know.
Acronym?
It's an acronym that stands for Learn, Engage, Adapt, Do. But basically what it consists of is a number of cards, weekly communications, and covering a variety of topics like professionalism and communication and conflict resolution and time management. Some things that are really important within a healthcare facility, well, actually, for that matter, within any facility or any kind of a work environment, of just figuring out how best to work together and how to really communicate with each other and do a variety of things. And we were also going to have Michael Wemple talk about that, because his facility actually piloted the LEAD materials, and they consist of, like as Cindy said, they consist of these cards that you have a champion in the facility that actually oversees what's going on, and they're generally done in huddles, and there are posters that you can put up around the facility that are reminding people of whatever the topic of the day is, and then there's check-ins to see, okay, how did that go for you, and how are you doing this, and Cindy, jump in here if you want to provide any more detail than that. But those materials are available for you for free. I'm not sure if we have any of the printed ones left already, but you could reach out to us, and our workforce coordinators are the ones that have been handing those out to facilities. But even if we don't have any printed materials left, we are making all of these materials available to you via electronically, and you can print them yourselves. And again, as Carol pointed out, when we're done at the end here, we will talk about where you can access all these. Did you want to add anything more to that, Cindy?
No, you did a good job of summarizing it. That was great. Yeah, because soft skills are something that, constantly just need to have somebody help kind of, be the champion and work them through how to do some of those things that we all want employees to, like, have more exposure to soft skills that they don't maybe have all the time. So.
All right, and I did want to say too that those materials, in addition to some of the other materials we'll cover later, were created in direct response to what employers' needs that were expressed in the initial assessment we conducted at the outset of the grant. So just to bring that full circle. So our final,
Hey, Carol, can I jump in here for a second? Just one more time, ask people, I know some people are having to get off. If you could please indicate in the chat box, if you haven't already, your name and any of the names of the people that might be in the room with you participating in the webinar so that we have a complete log of who all has been participating. So I just wanted to ask everybody to do that one more time.
so if you could advance the slide, please.